back again. It's 14 days since my knee reconstruction. All that's left now is a lot of plasters from where they've gone in various places to do their business. In the previous video, I was really focused on being fit prior to surgery, and I still stand by that. That's the thing to do. But I guess my priority has shifted a little bit because I learned a lot of things. It's 30 years since I had the other knee reconstructed. Things have changed a bit, but some things haven't changed at all. For example, the amount of pain and discomfort, the difficulty in moving around, the small things that become big things. I mean, for the first week, to make a cup of tea took a lot of energy, and afterwards I'd sit down and be in pain for 20 minutes or so. Fortunately, I've had really great support. My wife's been wonderful, my son's been driving by, it's fantastic. So I've made 9 points below here for you to have a look at. These are just simple realizations that I made as a consequence of the surgery, and they're really important. I would say the number one, if you are going to be on crutches, is to get those crutches at least a week before your surgery and become an expert. Now, just this afternoon, I had a chat on the phone to a friend who, a few years ago, he's the same age as I am, had a hip replacement. And he said the same thing. The first time he'd ever been on crutches in his life was after 3 days lying on his back. They get him out of bed, and he's a strong guy, and he struggled. Everybody struggles. We need to become proficient on crutches before the surgery. You can see the other things. Really work on your strength before the surgery. You won't believe how heavy your leg feels when you try to move it, when it's painful, when it's wrapped up. This had a lot of bandages on. It was very thick. It had a wraparound brace as well, so it was a big cumbersome thing for the first few days. And set yourself those schedules to do your rehab. You won't feel like it, but it's really important. So I've just been basically sitting here during the day and sleeping in bed at night, and I haven't really been going very far. I'm just starting to get reasonably mobile now, and you may be the same. And when I set this up, it was about, I had injury in mind because that was my situation, but like my friend with his hip replacement, and another friend who's contacted me in the last couple of weeks who's having a knee replacement, sometimes this surgery will be elective. And so the good thing about that is you go into that surgery without an injury hanging over you, so you have a lot more strength, you have a lot more normal fitness, and really build on that. So I wish you all the best for whatever you're doing, and I'd encourage you to click on one of the links above or below and go and have a look through the rest of the site. It's a fantastic resource. It's really designed to work with over a 12-month period to create absolute vibrant health. So thank you. I'm Ian Newton. I wish you all the best.